What like with the show The Pit, I from my perspective, I think they do a great job of like showing how important nurses are and how like they are just couldn't function without them. What is your impression just as a general kind of been of your profession being shown on that show?
I think the respect that Robbie has for Dana is so important. She's the queen, she's the boss. Like I
Yeah.
love when he does that because it is, physicians really can't run, floors, can't run units without nursing assistants, right? And
Yeah.
it runs a lot more smoothly when you have mutual respect for each other. But actually, my favorite part of the pit is because this is such a real thing, and like unless you work in healthcare, you really don't know. But nurses are huge gossips, and the fact that they portray that on the
Yeah.
show as well is so iconic to me. I think that is so funny and that is so dead on.
Yeah. Yeah, I think like the hospital we work at is well staffed, but I work at some rural places and whatnot, and maybe they're not as well staffed. And when you really realize that you can't do anything without nurses, is like you get a crashing patient, you're in the room, you're like, I want this med and this med and this med, and then the nurse leaves to get the med, and like they're the only nurse there, and you feel helpless. You're like, oh God, I can't do anything without the nurses.
Yeah, that's one thing. We don't have access to the Pistons. We can't get
Yeah,
the
we
Pistons.
can't get anything. Yeah,
Oh, that's actually really funny.
yeah, awesome.
The
So
Pistons is where to get the medication at for people don't know. It's where the medication is locked up at. So
yeah, yeah, yeah. What so season 2, you've been what stood out to you so far? July 4th shift.
I think seeing the characters change a little bit. Especially I loved Whitaker. He was kind of like last season was getting dumped on. Just the classic kind of first year resident type situation. But this season, he's actually coming into his own, and he's like, educating other residents. And I think that's so fun, and I
Yeah.
love that. And I also love Langdon's return. He's one of my favorite characters. And to see, him apologize to Louis is amazing. And I think his scene with Mel, where he, apologizes to her as well, one-on-one, that's kind of really stood out to me.
Yeah, awesome. Well, let's dive into the clips. We're gonna play your clip first, and
Sure.
let's discuss.
I'm sure you have some questions. I know it's a lot to take in.
It's a tumor. It's a brain tumor.
Well, it's a mass. About 4 centimeters in the frontal lobe.
Is it cancer?
We can't say for sure right now. It could be many things. Infection, inflammation, a benign cyst.
Is it what made me fall?
Yeah, possibly. We'd like to keep you here and treat with dexamethasone, which is a steroid to take down the swelling. And then we'll need a brain biopsy to know exactly what it is.
You're gonna cut open my head.
It's just a small hole. We'll do a CT-guided stereotactical biopsy with a blunt, thin needle, which sounds crazy, but it's actually pretty amazing. I mean, most patients go home the next day.
I don't know. What do you think I should do?
I think this is a pretty good plan.
Powerful clip.
Definitely.
Tell us about why you chose it.
I chose it because, obviously, as an oncology nurse, like when the word cancer pops up, I listen. But also, I think it does a really good job of showing kind of, the humanity behind delivering these diagnoses. And I don't know how you guys do it. Like, obviously, this part of my field, but we also have a lot of time, right? We can dedicate an entire appointment to delivering a diagnosis of cancer, right? You guys have this clip was like 90 seconds, right?
Yeah.
Like no time. So it's really poignant to me. And it's also interesting because, he's automatically assumes cancer. And she's like, it doesn't have, we don't know yet. And I think that trips up a lot of people too, because the word mass is scary. But there's a lot of explanations for that. It could be benign. So that's why I picked this scene. It's just, there's a lot,
Yeah.
It kind of like you're saying, like you can dedicate a whole team. Sometimes we're coming in and tell them, and I mean they'll come in for cough, just the most random things, and we have a lot of incidental findings. And like she's kind of telling her, it's a mass. We don't know what it is until you get a biopsy and see. And then everyone thinks cancer when you hear mass, so it's kind of always uncomfortable to have these conversations. We do it a lot Be honest, sometimes we don't right, sometimes we don't. Sometimes, you say cancer, you should stop and give a break and let them process it. Sometimes you keep going and you don't realize that, you keep going and you haven't given them a chance to process what they've just heard. But it's a difficult conversation. And again, it's kind of hard for me to make the diagnosis. You need to get a biopsy. You need more of a workup. It's not done yet,
Yeah. 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 So that was our engineer here who was just saying how his friend was involved in a bad motor vehicle accident and showed up, and unfortunately his friend passed away, but they obviously scanned him as well and they found cancer, and they were looking for trauma, obviously not cancer. But in this scene, it's really it's hard to say, but unfortunately sometimes it's even more rushed than that, right? Like you may literally go in there and be like, oh, you came in because you thought you had pneumonia, but we scanned your chest and there's this mass and it could be cancer. And right as you're saying is the nurse may come in or someone else is like, hey, we have a CPR coming in 3 minutes. That takes up the next 45 minutes of your day. By the time you come back and you're like, oh, let me go back in there, they're like, oh, they left already, or they didn't want to wait, or whatever the case may be. And it's just like, I like right now when I'm like putting myself in their shoes, like that's just terrifying, right? Someone told you this news that's like life changing, and then you have to like, it may be a week, it may be 2 weeks before you see the specialist, before you get the scans, and that's just difficult.
Yeah, I think with time you get better, man. I think, like I said, early in my career, that was me. I would say, hey, found this mass, and I'll kind of keep going instead of giving them time to process. And then, I mean, someone actually corrected me, like, hey, give me a second, let me think about that. And I just had to think, like, oh man, let me take some time, let them think about that. Come back and talk a little bit later about it. But yeah, it's kind of rough delivering that news. I just met this person; they're here in the ER for something, and you're telling them this. I don't know them. I maybe never see them again. So.
Yeah, I mean, honestly, it's my uncle. He found he had liver cancer. Thankfully, he's alive. It was surgically resected. But I remember getting this call from my parents, and I'm the only person in my entire family that's medical, like extended family, anyone. And I knew it was serious because my mom called and then my dad called right after. And they just, when I answered the phone, they said, your uncle has metastatic cancer and he was told he was going to die. And I was like, what is going on? And it turns out, so he had gone, my aunt, his sister, had just died of cancer. And he used that event to, he'd been having abdominal pain, nausea, some like general symptoms. Went to the ER, ended up getting a scan, and they saw a mass. And that's what apparently a nurse told him, which I don't know, this is definitely not true. But someone came in to tell him, you have stage 4 cancer. And then that was it, because they also saw a nodule in his lung. But that was it. And I was so stunned, but, also thinking this was kind of, during COVID as well. And I was like, how many other patients, did they have to see? And I know oncologists, that are trained to do this, that still make the same mistake of not pausing and allowing patients to process, right? And I think that's where nurses are really kind of coming, quote unquote, in handy, right? We're able, when the doctors see multiple other patients, we can sit with the patient and be like, how can we help you process this? But I still don't know how you guys do it. Like, it's always been a life-changing thing. Like, like people hear the word cancer and the world stops. But your guys' world certainly doesn't stop.
Yeah.
Like you could have someone who just died next door and you have to just snap out. So I applaud you guys for doing what you do, even dealing with something as crazy as this.
Yeah, for me personally, there's very few things that kind of give me that pit in the stomach of like, oh man, I don't want to do this. One's like, obviously when someone passes away, updating their family that doesn't know yet. And close after that is the cancer, like having to go to the room. Like, I'm like, oh man, let me do this other thing before I do that. Cause it's just like, oh my, like I know that entire reality is going to change and it's just like nothing you can do about it. Mm-hmm. What, if you were like, giving her advice, would you say she could have done anything better in that 90-second clip? Like, obviously, unfortunately, she doesn't have the luxury of time, but would you give any critique, or you think she handled it pretty well there?
No, I think she handled it so well. And I think she explained, even the fact of a biopsy, a brain biopsy is really scary, right? Because most people think, you need to cut open. But I thought that piece was so perfect too. She really just took the time to be there, sit eye to eye with the patient and deliver this horrible news in a way that he could process, even though, his mental state is obviously kind of frazzled to begin with. But no, props for Dr. McKay in this scene. 5 out of 5.